Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer from Douglas County with another of our Facebook Live sessions. We've been doing these now for about 18 months, so it's been a very long time. And unfortunately, this has been our darkest week of the pandemic with record number of hospitalizations and record number of deaths. So we'll bring you through it. Again, this is our time for me to answer your questions. A number of people put questions into Facebook Live, and we'll go ahead and do that. And But we'll also take questions if you put them in the chat. So if you want to send us questions to Facebook questions at douglaspublichealthnetwork.org, and we'll get them to you. As always, we start at the world and then move down. And so in the world, the number of cases is actually flat. In much of the world, cases are even. South America, they're going down. But in North America, especially in the U.S., cases are really quite up. When I look at the world, I worry a little bit about Iran, which has a lot of cases. You know, they border Afghanistan and Pakistan, and with so much disruption there, I worry that we could have another big outbreak there. I also look very carefully at Africa. Africa continues to have a moderate amount of cases, and I worry in Africa because there's a new development of a new variant there called C12, which we'll talk about later. But C12, I always worry about new variants because until you really know about the new variants, they could be dangerous. I'm also looking a lot at Israel and the UK. Israel and the UK have had a big COVID spike a few weeks ago. It came down, but both of them now are trending back upwards, and those are worrisome because they've had a combination of a lot of vaccination and a lot of COVID. So you'd think they should be through this, yet they're having another surge. In the U.S., we're clearly up in the number of cases, hospitalizations, and deaths. You remember, for those who've been watching for a while, that this started kind of in Missouri, rural Missouri, and then moved to Arkansas and Louisiana, and then moved across the Gulf to Mississippi, Alabama, and Florida. But now it's sort of calmed in Missouri and Arkansas, but now it's moving to Kentucky, Tennessee, West Virginia, South Carolina. So really a worrisome spread of the disease. However, despite the fact that we know that there's Delta in places, New York, New Jersey, Boston, and Michigan, very little disease there. And the answer is, what's going on? And I don't know what's going on, but I looked at it today. So we look at the states with the most disease, the 15 states with the most disease, all, except for Florida, have less than the average number of vaccinations. Now, Florida has a little higher rate because they have a lot of seniors, but of those states, all have less than the average number of vaccinations. And then you look at the states that have the least disease, they all have a higher than average number of vaccinations. So there seems to be a very clear correlation between the amount of disease you having correlating with the low vaccination. Places that have high rates of vaccination have low rates of disease. I don't think I can make any other correlation than that. In Oregon, we're kind of right in the middle, a little higher than the national average, but we're kind of right in the middle. And what we see again in Oregon is a lot of disease on the Washington border, in the bordering counties on the Columbia, and then a lot of disease in Southwest Oregon. Again, the pattern that we see with the states kind of fits in Oregon. Places in Southwest Oregon with low rates of vaccination, places on the gorge with low rates of vaccination have a lot of disease. Yet in Portland, Hood River County, Benton County, whatever, they're not having very much disease at all. So Benton County, about a tenth as much disease as we're having. And so that really is a concern and really a suggestion that vaccination plays a key. In Oregon, we're struggling with this. 1,100 people in the hospital in Oregon. A lot of people, kind of a high during all of the pandemic. And there's almost no open hospital ICU beds or even other beds. And this is at a time when hospitals are canceling elective surgeries and whatever else. So the number of people in the hospital with COVID is just overwhelming. In Douglas County, we have had just a miserable week. Today we have 137 new cases. And when I looked, we have as many cases in August as we had from the entire pandemic, starting at the very beginning until July the 20th. And so think of that, all that work and all those cases we did between the beginning of the pandemic through July 20th, and now just in 1 month, we have that number of cases. There are 109 Douglas County residents in the hospital, 109. I mean, before this surge here, 20 was a lot. 109 today. And of those, 80 are at Mercy, but 29 are in other places because Mercy's running out of room and they're needing to transfer them. So there's a bunch up at Sacred Heart. There's a bunch up at OHSU. There's a bunch up at the VA in Portland. There's some out of state because they need ECMO. Really, really worrisome. When we had our report earlier this week, Dr. Gray reported that 16 of the 17 people in the ICU were unvaccinated. So 16 out of the 17 unvaccinated. When we looked at our numbers now, of the 109 people in the hospital, 103 are unvaccinated. Since more than half of our adult population is vaccinated, that makes the risk of not being vaccinated more than tenfold. So more than a tenfold risk of being unvaccinated. And these numbers we calculate every day differ a little bit. Sometimes 8 times, 10 times, 12 times. But overwhelmingly, your highest risk is not being vaccinated. We used to see a few deaths a week. And a few deaths a week was just heartbreaking. Now we're seeing a few deaths a day. And so many of these deaths are in younger people. They are in people who are in their 40s and 50s. And being in my mid-60s, I will tell you, the 40s and 50s at the time you're just getting your act together. You've raised your kids. You're looking for them to play high school sports, graduate from high school, get married, and have kids. And these people are going to miss all of that. And to me, that's incredibly sad. And another sad thing that I heard today was somebody whose mom was in the hospital and had been in the hospital for a while and could only do video visits. So hasn't really even been with her mom, hold her hand to comfort her in the whole time she's been in the hospital. And she's now on a ventilator. And they get a daily call from the nurse telling how things are going and it's not looking good. I mean, what a tragic thing. This grandma's got young grandkids here in Oregon that will grow up without their grandmother. So again, we're really, really at a dark time. And again, overwhelmingly, it looks like the best thing we can do in the long run is to get vaccinated. In the short run is to protect ourselves. In almost all of these cases we see, we kind of know where they get it from. Oh, I was at work and there were these people who were sick at work and they gave it to me. In the case of this story, it was somebody else in the family who'd been exposed, didn't know they were sick yet, and yet they'd given it to the other people. So please, 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 we want people to stay safe. And the ways to stay safe are to stay at home as much as you can. If you need to go out, avoid crowds, wear a mask. Certainly stay home if you're sick, and please get a vaccine. Okay, let's go through the questions. I have some stuff from the literature that I'll bring out this week, and we'll see. So I'm currently receiving chemotherapy, and my oncologist has asked that I receive a booster shot. He asked me to contact my PCP here in Roseburg. My first vaccine was the J&J. Ooh. And the question is, what should you do? This is really a problem. There is clear evidence of what you should do if your first shot was a Moderna or Pfizer. We have no guidance from the feds as to what you should do if your first dose was the J&J. Should you get a second J&J? Should you get a Moderna? Should you get a Pfizer? And I just pray that the CDC and the FDA gives us some guidance. So Aviva and the other people in town are following the CDC and FDA recommendations. And so just tragic. Now, there's some people going off-label and doing off-label things, and I'm not saying they're wrong to do that, but we're trying to get people to follow the label recommendations. Bruce says, what do we know about the C12 variant? So the C12 variant seen in South Africa is still not accounting for a lot of cases. We don't know that much about it. However, we've been able to sequence it, and we look at some of the genes. We worry that some of those genes may make the vaccine less effective. So C12, clearly on our radar. We're going to look at that. It's not what we're seeing here. Overwhelmingly, what we're seeing here is the Delta variant. In fact, when I looked, I think the last 20, 19 of 20 were the Delta, and there was only one Alpha. So it looks like we're all Delta all the time now. So someone says, it looks like every day where there's more news about kids getting harder by the Delta variant with articles about how children are taking up more beds in pediatric hospitals. So what's going on here? So the story is that we're seeing a lot more disease everywhere. And when you see a lot more disease everywhere, you're going to see a lot more disease in kids. Thankfully, we've not had a lot of serious disease in kids. We've had a lot of cases and a lot of kids who have been kind of cranky. We had a 29-day-old admitted the other day who was just cranky. We had a 17-year-old who was in the ICU. So we're starting to see some of those cases in pediatrics. So someone says, well, how safe is it to send kids to school? Well, if kids go to school and they follow the rules, we think it's very safe. We looked at this carefully. They've looked at this very carefully in Utah. They've looked at it carefully in North Carolina and Atlanta. And if kids go to school and follow the rules, we're not seeing very much transmission in school. And going to school and following the rules, meaning separate and to wear a mask, we're not seeing much transmission. And so that's a good thing. However, when kids go to school, we do see more cases associated with school. But again, we don't think they're happening in the classroom. We think they're happening at the sleepovers. We think they're happening at the pre-game parties, the post-game parties that people go to. So I think it's fine for kids to go to school. School's really important, but I would ask parents to be really careful about limiting those other activities where the disease may spread, such as the birthday parties, the sleepovers, and the hanging out with kids on the sports team. Now, I was a kid, as my kids say, in the last millennium, but it wasn't that different then, that somewhat of being on sports was hanging out with your teammates. And I get that, and I know that a lot of important things in school are having parties and whatever, but I think we have to really, really tone those down now while the disease is spreading so quickly. So Bruce says, with no double-blind trials for the booster shot, why are we pushing the booster? So we're talking about a third dose. And some things you can do double-blinded trials. So I think trials of medications, you really need to do double-blinded trials. And double-blinded trials means neither the doctor who's giving you the medicine nor the person who's getting it knows if they've gotten the thing. So with the booster shot, it was really not possible to do a double-blinded trial. But what they did was they used a surrogate, and surrogates are perfectly logical to use. They used surrogates of antibody levels. So what they did is they found people who did it before and then after, and they found their antibody levels. They found that the antibody levels really shot up. And we know that antibody levels correlate with protection. And so when they had this big increase in antibody levels, that's why they've recommended the third shot. Ginny says, I read Dr. Powell's thing about antibody-dependent enhancement. So antibody-dependent enhancement is a rare phenomena that happens when the antibody that you make from a vaccine or even from the disease, rather than helping you fight it the next time, actually makes the disease worse. So that happened with the RSV vaccine, which was pulled off, which never got to market, and happened with the dengue vaccine, and sometimes happens with the disease dengue itself, so that you get dengue and the next time it's worse. And so when we were making a new vaccine, we were very concerned about antibody-dependent enhancement. And I think I even talked about that back last fall when I talked about the uncertainties leading to it. And the way you know that you'd have antibody-dependent enhancement is that people had the vaccine and got sicker than the people who hadn't gotten the vaccine. And so antibody-dependent enhancement was a theoretical concern. I too saw that in Dr. Powell's thing. I think he was mistaking antibody-dependent enhancement for vaccine resistance, totally different phenomena. So vaccine resistance means that new variants come out are less well treated by the vaccine than the original ones, and I think we've definitely seen that, right? So this vaccine was made against the original ancestral viral forms. Well, over the time, it had a bunch of mutations. First, that D614G. That didn't actually seem to affect the antibodies very much. We had the Alpha variant. That also didn't, but Delta clearly does. And the vaccines are about 10% less effective against Delta than they were against Alpha. So unless somebody can tell me what he was meaning, there's been no discussion that there's any antibody-dependent enhancement. There is some decreasing efficiency of the vaccine, totally to be expected, and that's why we want to get rid of this or bring this virus down to the lowest levels possible so we won't be developing new variants. So someone said, thanks for what's due, and I can tell you we really appreciate all the kind words we've gotten later. So someone says they're a teacher and they've been fully vaccinated. They are saying I should get a booster at 8 months. So they got the first dose at Aviva, so where should I go to get my booster? So again, the recommendations for boosters for the general population, or third doses for the general population, are not there yet. I think they should come out soon, and I think they're going to say you should get a third dose 8 months after your second dose. I think they're going to say you should try and get the same vaccine, but if you can't, to get any available vaccine. And I think we're going to try and do those. We might do some big events, but there's so many places now that have vaccine that you can just get it anywhere. You don't have to get it any place special. Everybody in Oregon can check to put the stuff in the same database to be sure that people get the vaccine that they get. So one of the question comes up is, what do we do? What is public health doing, and what's public health's role in all of this? And we probably talked about it in the past, but probably a good time to talk about it again. So the healthcare system is complicated. We have doctors' offices. We probably know about those, urgent cares, hospitals, and then we have public health. Public health is not involved in any clinical work. We don't see or touch any patients. Public health is there about prevention of disease, and we prevent disease by working on vaccine programs. We work on information programs like this. We work on contact tracing, that is finding people who've had disease and trying to prevent them from stopping it. We work on this by working with providers to help them if they have questions about what they should do in the office. So we get a lot of questions about, this person got this weird rare disease. What does public health recommend we do for that? That's the kind of stuff we do. We do not touch patients in the exam room, and we do not regulate what happens in doctors' offices. That is totally not my job. So people are trying to tell me, oh, you should tell this clinic to stay open later. You should tell this clinic to start doing this or stop doing this. That is not public health's job. The job of doing that, of telling doctors what they should or should not do, is the medical board. So if a doctor's treating people in a weird way or not treating people in the right way, it's not public health that does this. It really is the medical boards. And again, once people are hospitalized, that's really on the hospital system to take care of them. Our job is prevention of disease and control of disease. Once people are sick in the ICU, there's not much we do about that. And again, the other health things, the hospitals and the urgent care clinics and the doctors' clinics, are funded in a different way. They are funded through insurance payments, co-payments you might make, or Medicare or Medicaid. That's where their money comes from. Public health is funded by the state and a little bit by the county, but mostly through the state funds public health. We don't collect money for anything that we do. We don't even have a way to collect money. And so that's how that it functions. So people are confused about that, and so that makes up that confusion. So someone says, has anyone figured out why some people end up with long haul symptoms and organ damage while others don't? That is one of the great, great mysteries of this. So we know that somewhere between 25% and 40% of the people who get COVID will report symptoms that go on for weeks and weeks and months. And those symptoms can be fatigue, they can be brain fog, they can be just a total lack of strength and stamina. Shortness of breath with the least little bit of exercise, and extreme fatigue. So people tell us about, I used to be able to go out hunting and whatever. Now I go out the door to get the newspaper and have to sit on the couch for an hour to relax. We don't know that, and that's going to be one of the great things to figure out. Is there a genetic predisposition to this? Did something happen with the disease? We don't really know. There are some reports that people have the long haul symptoms actually get better when they get vaccinated. And so that suggests some kind of immune response. But again, we don't know that. And that, we think, is going to be one of the long-term stuff. I mean, think about 4,000 people having COVID this month. Let's say even the low number, 20% of those people have long COVID. That means that 800 people this month are going to have long COVID. And a lot of people with long COVID can't work anymore because they're so weak and tired. A lot of the people with long COVID, their lives are, the quality of their life is really down. You know, they're used to being active and out, whatever, and now they're spending all their time being sick. That really is hard, and that's one of the biggest concerns that we have. So someone says, if the vaccine's so safe and effective, why are healthcare people not willing to get the vaccine? So that's a very interesting question. And so the state actually has pulled the data on that, so they know all the people who are licensed in the state, and they see how many people have gotten the vaccine. The overwhelming majority of doctors and nurses have gotten the vaccine. So I know there are some doctors and some nurses who have gotten the vaccine and have been really loud about it, but there aren't very many. So you can actually go on the OHA website, and the OHA website has these little curves, and they show the rates of vaccinations among the different licensed professionals in the state. And for the most part, licensed professionals are getting the vaccine. Now, the story is that people get the vaccine. You should be quiet about it. I got the vaccine. The people who are not getting the vaccine and making a big hubbub about it are really loud. So it sort of sounds like, well, it's like maybe half the doctors have gotten it. No, we know the number is well over 90% of the doctors who've gotten it. So why are they not getting it? I don't know. I mean, I've talked to a few of them. Some of them have notions about the vaccine that I can find no backing for. You know, for young women, one of the biggest ones is fertility. And every place I looked, and that is only a rumor, there is no data at all. Not a single study that suggests that fertility would be negatively affected. And many studies to suggest that it should be normal. They look at sperm counts before and after, no difference. They looked at fertility among the people who were in the early trials, no different. And so I don't know. The question is, I know nurses have been working with COVID patients who still won't get it, and they're on the front lines. What's up? And I don't know what's up. What are they going to do when they lose employees in weeks when the mandate occurs? So there is a vaccine mandate, and again, mandates are always dangerous, but there's a vaccine mandate that all healthcare workers need to be vaccinated by October the 18th, or they can't work in healthcare. And the concern is, and I think I think that's a big concern for organizations who are already having trouble recruiting nurses and others, that things may cause a problem. Well, let me tell you a story about what's happening here in Douglas County. So we have 16 long-term care facilities that have outbreaks. In 15 of those 16, what happened was an unvaccinated person brought it into the facility, a worker. They gave it to other unvaccinated workers. It then spread through the facility and then spread to patients, some of whom got very sick, some of them got hospitalized, and a few of whom have died. In the one nursing home in the one facility where most people were vaccinated, a vaccinated person had a breakthrough case, it spread to just a few people and then it was gone. Whereas in these other areas, it's spreading like wildfire. So the reason for the mandate is, I mean, we don't want the vet workers to get it, but we really don't want the staff to get it. And it really appears that the way to prevent that is by getting the staff vaccinated. Now, are we going to lose employees? I don't know. You know, you don't know what's going to happen. I'm an old man. And so I've been through this a lot. I know in the early 90s, when we had mandatory hepatitis B vaccinations, the word was everybody's going to quit. Didn't happen. Then in the 90s, when we started doing smoking restrictions on offices, people are going to quit left and right if they can't smoke in their office. Didn't happen. In the 2000s, we saw people say that when you quit smoking in bars, that all the bars would go out of business, that not a bar would remain. I looked around, there's still a lot of bars out there. We heard when President Trump got elected that all these people were going to move to Canada. Didn't happen. So I don't know what's going to happen with this. I mean, there may be nurses and doctors who decide that they're going to not work in healthcare anymore. They may be nearing retirement and say, look, I'm just going to stop working. That could happen. There may be people who are going to say, look, I work in healthcare and I'm just not going to get the vaccine. I'm going to go from healthcare to some other industry. That could happen. There could be people in healthcare who are going to say, look, I'm not going to get the vaccine. I'm going to move to another state that doesn't require it. And indeed, that could happen. So I don't know what's going to happen with the mandates, but I can see the reason that we want people to be vaccinated. These stories in nursing homes are really, really, really problematic. Let's look at Mercy. They have some people who are not vaccinated. They've got a lot of cases. And in a lot of cases that they got, in the cases they got, mostly among the unvaccinated people. So while they're struggling with staffing, some of the reason they're struggling is that unvaccinated people got sick, they're home on isolation, and they can't work. So I don't know what's going to happen with the mandate. It's going to be interesting to see what happens with the mandate. It's going to be interesting to see if people quit. It's going to be interesting to see if people seek medical or religious exemptions. So someone says if the vaccine isn't showing effectiveness to Lambda, why get it? Okay, so Lambda is not really here very much. We don't know what the vaccine with Lambda is, but even if it's only 50% effective is better than nothing. So I had a lot of friends in law enforcement and they wear bulletproof vests. They know that they're not 100%. You can shoot around the vest, you can shoot through the vest, there's chinks in the armor, and all kinds of reasons, but they wouldn't say, I'm not going to wear it because it's only 50% effective. No, you layer on the protection. You know, when we drive in a car, seatbelts aren't 100%, airbags are not 100%, driving safe is not 100%, but you link all those things together and it's so much safer than when I first started driving in those early ages where there were no seat belts, no airbags, and the cars were really death traps. So someone says, what is the survival rate for Delta variant children? It is great, right? So almost all the kids who get Delta are going to survive. So that is really, really good. You know, if it had a terrible survival rate, 50% of the kids died, we would be much more worried about kids. The survival rate for Delta in kids is great. However, the hospitalization rate is certainly not zero. We've had a bunch of kids hospitalized over the last few weeks because they're really sick or they're really cranky. This one fellow up at OHSU, really, really, really sick. So I think you really need to worry that you really need to worry about that. And what we're seeing is the age is creeping down. 20 some odd year old in the hospital now, and who's really very, very sick, and somebody with no underlying conditions. I mean, I don't think anybody in their 20s expects to be on a ventilator and perhaps die from a disease such as this. Someone says, do you see another lockdown coming? I'm a teacher and I'm afraid to go back to school. Yeah, I can see the nervousness about going back to school. I do not see another lockdown coming. Certainly in the way things are in Oregon, much of the state has low levels of disease, and there would be no reason to do a lockdown in Hood River County, in Benton County, in Clackamas County. There would be no reason to do a lockdown there because the number of cases is low. The places where you would need to do a lockdown, Southwest Oregon, I don't think there's any appetite for that. And again, lockdowns are governmental actions to ask or force people to do things. That is not the way we should be doing this. Right? We should not be getting vaccinated because the government tells us to. We should not be staying home because the government tells us to. We should be staying home because we've used our brains and we say, look, getting vaccinated is so much safer than getting the disease. We should be staying home when there's a lot of disease out here, not because government tells us to, but because we know that to stay safe, it means not to go to crowded parties. And so please, let's not trust government to do all this stuff. Government is slow to respond. They do nothing until they use a sledgehammer. So let's not involve them. Let's take it upon ourselves and take some personal responsibility to do the right stuff. Now, what I did touch on there is a great study that came out this week from the UK, and another one that came out from Israel, that looked at the side effects of the vaccine. And both of them found the side effects that we expected to find. So the Israel study showed myocarditis from the mRNA vaccines. The UK study found a risk of bleeding from the vaccines. But what they said was, if you have the disease, your risk of having the myocarditis or the risk of having the bleeding is so many times higher than actually having the vaccine. And certainly with Delta around, if you don't get the vaccine, you have a really high rate of getting the disease. So much safer to get the vaccine than to get the disease. Can you tell us how many of the vaccinated deaths we are seeing having underlying conditions? It's obviously concerning that we're seeing deaths among the vaccinated, especially younger. It'd be helpful to know if these people had underlying conditions. So again, let me tell you the story on underlying conditions. Underlying conditions is very broad. Obesity, overweight, history of obesity, smoking, history of smoking, any lung disease such as asthma, any high blood pressure. And so when you look at people, by the time you get to be 65, 85% of us have an underlying condition. In fact, I have been trying to find among my 65-year-old friends, if any of them don't have an underlying condition, I've yet to find one. So again, underlying conditions are one of those things that creep up with age. We get a little overweight, we get a little high blood pressure, we have a little bit of something else along the way. We are seeing younger and younger people with fewer and fewer conditions. So we said there's one person who's 20 say have no underlying conditions. And when we see these pediatric cases, they're just basically like the next kid. I mean, there's nothing that separates them out as old and sickly. Now, the people who are old and sickly do worse with this disease. There's no question that people who are elderly do worse with this disease than young people. But I will tell you, as we see these people in their 20s, 30s, and 40s who are on ventilators, they really don't look different. They're really not like dying of cancer and then get this. They look like the rest of us. You know, some overweight, some high blood pressure, whatever. This is not a really sickly crowd. Now, early on, I will tell you, in the first parts of the pandemic, where most of our admissions were people in nursing homes, yeah, a lot of them had stuff. I mean, you don't go to a nursing home because you're feeling fit as a fiddle, right? You wind up in a nursing home because you got a lot of stuff going on. But I will tell you, overwhelmingly now, the people who are really sick, the people in the ICU, are younger and healthier than me, and I consider myself to be young and healthy. So this is not what we saw in the beginning, where this were mostly really old, sick people. It's really awful. So how, somebody says, how important is COVID community spread by asymptomatic people in the county? So asymptomatic is confusing here, because asymptomatic in general means you don't have symptoms. But I think when we've looked at it, there are three categories of people who have COVID. One are people symptomatic, coughing and whatever else. We know they're spreading the disease a lot, so we know they spread a lot. We then have people who are pre-symptomatic. Pre-symptomatic means they have no symptoms on Monday, they get their symptoms on Tuesday. Those people, they are asymptomatic, but better described as pre-symptomatic. They are incredibly contagious. The third group are people who are asymptomatic during the entire course. So that is, they never knew they were sick, and they go in and get a test, a weekly test at their employer. They get a test before they go on a cruise or something, and they've never had any symptoms at all, and they're the ones who are truly asymptomatic. When we look, those people tend to have very low viral loads, and we don't think they're spreading it a lot. And actually, when we look around, there are very few people who have a pristine history. Look, I just stayed home and I got the disease. Most of the people have been around others and have been around others, and that's where they get it. So Rebecca says, what's the percent of vaccinated versus unvaccinated testing positive? Overwhelmingly, the people who are testing positive are unvaccinated. So we have a lot of people there. So over the weekend, my wife and I spent a time looking at the vaccine status for 40 consecutive cases. And the answer was, so we looked at 40 consecutive cases of people 12 and above eligible for vaccine. Of the 40 cases, 5 were fully vaccinated, and 35 were unvaccinated. So the risk of getting COVID is 7 times greater for the unvaccinated. For being in the hospital, it was 10 times greater. So the vaccine efficiency in that group of cases, symptomatic cases, was 85%. We're not doing a lot of screening of asymptomatic people, so we can't tell you. But for symptomatic people, vaccine efficiency, 85%, 7 times greater risk if you are unvaccinated. So that's the story. So my mom is 71 and has COVID. She's at day 14 and still testing positive. Is this normal, Christine asks. No reason to get repeat tests. So we know that if you are positive, your PCR test could stay positive for a long time, even past the time that you're contagious. So we're not recommending people get repeat tests except in very rare circumstances. So the story is, if she's at day 14, has not been hospitalized, and is not immunocompromised, she should no longer be contagious, but her test may stay positive for another month or so. If she'd been hospitalized or is immunocompromised, she should be isolated for 20 days. Jesse said, I heard rapid tests are being recalled for not being accurate and is designed to pick up any virus, not just COVID. That is just a bunch of bunk. There is nothing about that. There was a recall of an antibody test, but that is not the rapid test that we're talking about. So Debbie says, if I'm vaccinated and wearing a mask in public, is it safe to shop, play bingo, and my regular activities? So you remember when we talked about this from the beginning of time, we never say something is safe and unsafe. We talk about where you are on the risk factor. So being vaccinated, great thing. Wearing a mask in public, a great thing. Shopping, if you're careful about it, people got to shop. Shopping is generally safe. The air handling in shops is pretty good. You tend not to be around any one person for more than a minute or two at a time. And you can, if you see a crowd at the pasta aisle, you can wait until the crowd in the pasta aisle leaves and then go there. So you have an ability to go ahead and make it safe. So I think at almost any time, shopping is a relatively safe activity. Playing bingo, very different. So playing bingo, typically people are close together. Playing bingo, you're typically with the people around you for a long period of time. The air handling in bingo halls may or may not be good. Bingo, much more risky. And other regular activities, I don't know. So right now, with the amount of disease we have, shopping, people have got to do it. It's okay. Outdoor activities, perfectly fine. Playing bingo, going out to eat, pretty risky at this point. So I think you need to be cautious. So if you had a bad reaction to the flu shot, is it safe to get the COVID vaccine? So the flu shot and COVID vaccines, very different vaccines. Most of the people who have had bad reactions to the flu shot had a bad reaction to the egg component in older formations. There's no egg in the COVID vaccine. Now, there are some people who just have really twitchy immune systems, and they have allergic reactions to lots of things. Those people are at more risk, but if you go to a place that can handle an allergic reaction, very, very safe. It's certainly safer than getting the disease. So again, when the study in the UK and Israel looked at it, it was far safer to get the vaccine than to get the disease. Now, the safest is to get neither, right? But to do that, you have to basically stay home and never be around anybody else. That is not a long-term solution. So Cindy says, in your opinion, should large companies who have a lot of staff test positive, should they continue to operate? Hard to know. I know there have been some big prominent businesses in Douglas County that are shut down for a few days to get things under control. What they should do is they should follow the suggestion for companies that have outbreaks. So for companies that have outbreaks, what they should do is they should mandate mask use. They should not have like the morning meeting where everybody's together. They should increase the ventilation in their stores. And if they do all the things that they should do, they can continue to operate. Now, if some stores have had to close just because they don't have enough people. So Jamie says, are there any supplements recommended to boost the immune system? Well, the immune system is very complicated, and there's no one particular thing that boosts the immune system. We know that people who are stressed or people who are overtired, their immune system don't work as well. So work on stress, work on being too tired. In terms of vitamins or whatever, there's none that have been proved to help. We know that people with low vitamin D levels seem to have a worse trouble with the disease, although it's not clear that boosting the vitamin D levels work. But taking multivitamins, including D, is perfectly safe to do. There are a lot of people who are interested in taking zinc. Zinc is perfectly fine. And if people want to take multivitamin and mineral like zinc, I think that's great. So Jenna says, how long after testing positive are you contagious? So for most people, it's 10 days. For people who have weakened immune systems or a real severe disease that cause hospitalization, we say 20 days. We are not recommending tests to get out of isolation. That has caused so much more heartache than it's worth. So Kathy says, I hear you can spread the virus if you're not vaccinated, so why are you pushing the vaccine? Oh. So people who get the vaccine, again, 7 times less likely to get sick. You do spread the virus when you get sick. And so you're 7 times less likely to get sick, so 7 times less likely to spread the disease. And a good study from Singapore this week suggests that people who get the disease spread the virus for a much shorter time. So you're 7 times less likely to get it, and you spread it for a shorter period of time. That's the reason to get the vaccine. So Nicole says, does the vaccine have DNA fragments in it? It does not. The mRNA vaccines have mRNA in it. So if you remember back in the class, there's DNA and then there's RNA. The mRNA vaccine does have fragments of mRNA in it, but do not have fragments of DNA in it. So do employees have until October the 18th to be vaccinated? I looked at the rule today, and they have until October 18th to be fully vaccinated. So fully vaccinated for the mRNA vaccines is 2 doses plus 14 days. So the people who are not yet vaccinated need to hurry up and start getting vaccinated. So Stacy says, how do we encourage vaccines when Evergreen are suggesting alternatives that people are using as an excuse not to get the shot? I'm not even going to go there. What's happening with the surge in pediatric cases and hospitalizations 0 to 5 in the state and Douglas County? Again, we're seeing a lot of cases in younger kids. Again, younger kids usually kind of get over this. Although, we are seeing some of the kids with long COVID. We had a provider talk to me the other day about a little one who had COVID a few months ago and is still sleeping all day. Sleeping all day, sleeping all night, wakes up for a little bit to play and eat and goes right back to bed, like the worst case of mono they've ever seen. And someone says, does the Delta variant cause fever 100% of the time? No. Actually, one of the things that's remarkable about fever is that with this Delta variant, we're not seeing fever all the time. And so people think, I must be fine because I don't have a fever, and that's not the case. Actually, what we're seeing is the fever later on, 3 to 5 or 6 days into it. So people who have been sick for a while and transmitting for a while, getting fever later. So how long after COVID can you get the vaccine? So we ask people to wait until they're out of isolation and feeling better to get the vaccine. So for most people, that's going to be 10 or 12 days after they were diagnosed. And and I don't see it in here, but one of the big ones is, natural immunity is so good we don't need to get the vaccine. Natural immunity is good. I mean, there's no question about it that the body is really good at making a natural immune response. But natural immunity from getting the disease is less good than the vaccine. So they looked in Denmark, where small country, they can look at everybody. And what they found is that people who had the disease had, pretty good protection after that. But if you were senior, like I am, you only had 50% protection. But the CDC then has shown that far and away the best protection is if you're unlucky enough to get the disease, then to get the vaccine. And then it turns out you've got the very best protection. So my daughter's school requires masks indoors but not outside. Is that okay? So the story on masking outdoors is you don't need to mask outdoors when you're out in nature. But if you're going to be outdoors and in a crowded spot, you probably should. And this came from 4 outbreaks in the Pacific Northwest that we saw where people were outdoors and yet they still spread the disease. Now, it's so complicated to know when the people were outdoors. Did you get it when you were outdoors, or did you get it when you were in this long line waiting for the bathroom? Did you get it in the bathroom? Did you get it when you were waiting for food and there was a big long line at the food thing? So we don't know about outdoors. So the recommendation now and the requirement in Oregon is to wear a mask when you're outdoors and can't maintain distancing. So if I'm outdoors riding my bike or gardening, I'm not going to wear a mask. But if I would go outdoors and need to wait in a line for something, I would. So someone says, so what does the vaccine do for a person? So what the vaccine does for a person is it decreases your risk of getting the disease 7-fold. It reduces your risk of hospitalization 10-fold. And the way it does that is it causes your body to raise antibodies and other immune response to the virus. So the vaccine really works. Really, the people who think that the vaccine doesn't work, why should we do it? Really, really, really look at the data. The data could not be more clear. So football season's starting, and I'm a 50-year fan of the Ducks. Go Ducks. We have season tickets and looking forward to the coming season during the restrictions over the past year. We're seeing that vaccination is a condition of entry at Autzen Stadium. So how would you weigh the risk and reward while making up the not to go? Should I stay or should I go? I don't know. I mean, being at Autzen Stadium, you're kind of out, and it's not a dome. You're out in the typically windy situations. It never rains, but you may be in the windy situations. You're reasonably separated from other people, your spouse or whoever's sitting next to you, and presumably they're vaccinated, so the risk is low. The risk at Autzen is not, I think, going to be seated on the 50-yard line watching the Ducks pound everybody else. The risk is going to be at halftime when everybody's wanting to go to the bathroom and you're sitting indoors, or when you're trying to buy the $10 cup of beer and you're in a big line there. I think that's kind of where the risky time would be. And if you got there, decide I'm not going to hold my pee and not drink beer and just go in, go out, I think that's okay. So my daughter was supposed to get her second dose on the 20th. She ended up having COVID then. The urgent care doctor told her not to get the second shot. I think he's wrong. Should get the second shot as soon as she's well. That is the recommendation. So do we know the impact of Delta and other variations on animals? This is fascinating. You remember early on what we found was that COVID was being passed from humans to some of the large cats, but especially to mink. And so I didn't realize that many mink in this world. I didn't realize people were still wearing mink coats. But there are mink farms in Oregon, Washington, and in Europe, and there was a lot of spread among mink. Most of the mink were cold, meaning they're killed. And there aren't very many mink farms now, so we don't know much about the transmission from humans to animals. We do know that some of the large cats are testing positive for this, but Delta and the variations on animals, we don't know, and that'll be really interesting. So what percentage of teachers and school staff are vaccinated? So we don't yet have a good way to know that. We think it's between 50 and 70%, which obviously very wide. We guessed there were 2,500 educators, and we think we gave about 1,700 vaccines. But educators could have gotten vaccinated elsewhere, so we don't really know. For 12 to 17, how many are vaccinated versus unvaccinated? I don't know the number off the top of my head, but we'll look. So Jamie says, what about recommending healthy eating, exercise, taking supplements? We've been doing it. We've done 100 of these, and I think in at least 90 of them we said that the very best thing you can do during the pandemic is to eat well, to sleep well, to get some exercise. And if you want to take a multivitamin or a mineral supplement, that'll be great. Again, what we're seeing in the people getting sick is many of these people are pretty unhealthy in so many ways. Smoking, we're seeing a lot of obesity, and so really stay healthy. Staying healthy by healthy eating, exercise, taking supplements is going to help you in other ways. I mean, this has been a really stressful time. I cannot tell you the number of people who are screaming at me every day about all kinds of different things. And again, I go out of my way to have joyful times in my life, to get some exercise each and every day, to eat healthy, to do those things to stay well. Because we know that the people who are involved in this, and my life is not bad in comparison to those poor nurses. I talked to somebody today whose daughter's a nurse, and it's just tragic. They're working these long shifts. They're watching all these people die. I mean, nurses typically, so you're an ICU nurse, and ICU is an amazing thing. So when we get through this, I hope they do tours of the ICU, because many of us don't get a chance to see them on a regular basis. And when we do, it's just so overwhelming, you don't know what's going on. What happened in ICU is just magic. You know, when I started medical school back in the 70s, there really weren't ICUs. I mean, they called them ICUs, but there was nothing really special about them. What happens now in ICU is just incredible. All the different things that they can monitor on an ongoing basis, all of the different medications they can give you, all of the different things they can do in the ICU, ultrasounds, x-rays, all kinds of different things. Just didn't see that before. So the ICUs are pretty amazing and great places. And so, you know, while I worry about myself, what I really worry about is these ICU nurses. Because these ICU nurses are, as one nurse said, we're used to winning. So we're used to seeing the person come in with a gunshot wound who looks like they're going to die. We bring them back, and then they leave. And then a week later, on their way out, they congratulate us and send us flowers. Or we look at the person who has a heart attack, who goes in, has this cardiac angiography, survives their heart attack, and a week later is great and goes home and is incredibly thankful to the ICU nurses. This nurse said, the bad part about this, we're seeing a lot of people in the ICU, and we're not winning. Most of these people are dying. And, you know, many of the ICUs go a week without a single death, right? Everybody survives, goes out, does something else. They're seeing 3-4 deaths a day now. And so what I really was the emotional toil on the nurses who grow to really get attached to their patients. And watching this many deaths is really hard. So how many deaths have we had from the vaccine here and in the state? Again, in Douglas County, we've had 0 deaths related to this. Jennifer, you've asked this question again and again, and what I then challenge people to do is please get me the name or the number of the person who died from the vaccine. And the answer is, I haven't had any. I've had some leads. They say, well, I think this person knows, and I send them an email. They don't get back to me. I've checked with the hospital. I've checked with the medical examiner. We do not have any deaths that we think are related to the vaccine here in Douglas County. Again, my challenge to you is if you know someone, send me their name. And I will check out their death certificate to see if indeed it was related. We check out the medical records. Now, we have had a couple of deaths and hospitalizations following the vaccine that we can't, you can't really know if they're on the vaccine or not. All of them seem to be related to some other, much more likely some other cause than from COVID. And similarly, when we look at deaths, the state records all deaths that are recorded within the time of COVID. That's not the way we're doing it here. The deaths we're reporting are all based on medical records due to COVID. And there's people out there saying, oh, the deaths are due to something else. Not right. Not right. These deaths are due to COVID. So how many independents got sick when all 30 were vaccinated? Don't know the number. I think it was about a dozen or so that people got it. None got hospitalized, none got seriously ill. So, there was some breakthrough cases, and that happens. There are going to be some breakthrough cases. But again, remember the vaccine helps to prevent disease, but really helps to prevent hospitalizations. In this case, it was 100% effective. So can I talk about herd immunity versus the vaccine? So herd immunity is not versus the vaccine. So herd immunity means you get enough people in a community who are not susceptible to the disease, either because they had natural immunity or because they got the vaccine, and then the disease can't spread. The number of people who need to be immune is related to how contagious the disease is. A disease which is not very contagious, you could have as low as 50% of the people immune, and it's not going to spread. This one, though, is really contagious. So you're going to need over 80% of the people immune to keep this from spreading. And that's how we got rid of smallpox. Not everybody was immune, but enough people were immune that when smallpox got into a community, it didn't spread. We're there with measles. So when measles gets in, you see a little spread and then it goes away. Similarly with polio, somebody could come in with polio, and not everybody is immune, but enough people are immune that it wouldn't spread. So to get to herd immunity, you need a combination of natural immunity from people who have the infection plus the vaccine, and you add those together to get to the number for herd immunity. We think the number here is about 80%, and that's why we think we've not had much spread in New England, because they've had maybe 10 or 20% of the people who've had the disease, plus 60 or 70% of the people who've had the vaccine. Put those together, you're in that 80 or 90% rate, and that's why, although there is some disease in New England and whatever else, and clearly they've had Delta, because when we look there, they have just as high percentage of Delta as we do. But because they have the high levels of natural immunity from the terrible time they had this year, plus the high level of vaccine, they're not seeing much spread. Unfortunately, in Douglas County, we have a low rate of vaccination. People fully vaccinated, only 43%. We've had a relatively low rate of disease. I mean, think back, before August, we've only had 3,000 or 4,000 cases. So we only had 3,000 or 4,000 people who are immune because of the disease. Only in the low 40s of people who were immune from vaccine, means there's still 60,000 people out there who get the disease. So herd immunity is really the strategy. The strategy is to get herd immunity, and the best way and the easiest way to get herd immunity is to get people vaccinated. So undoubtedly, people have disease. We'd like people with natural immunity, plus the people who get vaccinated, to get that number up. And by getting that number up, you can keep the disease down. Now, are we ever going to have enough immunity where the disease will never spread again? No. There's no place in the world that's close to that. So I'm concerned about Bell's palsy as a side effect of the vaccine. Yeah, Bell's palsy is bad. So Bell's palsy is a thing where you get a reactivation of a herpes virus in your system, and with that you get a drooping of the face, and you may have seen that. And that is, and that was one of the things they looked at in these studies in the UK and Britain. So Bell's palsy happens after you have an immune insult. So it can be when you get the flu, after you get the flu. Sometimes it happens to people when they are on get cancer chemotherapy or something. Sometimes it happens if you get too much sun, and it happens after vaccines. So then one of the concerns that we'd had was that people were going to have a lot of Bell's palsy from the vaccine. We do see a little bit of it, but actually you get a lot more of it from getting the disease. So again, if you're worried about Bell's palsy, you should get the vaccine so that you don't get the disease. And again, Bell's palsy has not been a prominent side effect of the vaccines. So someone says, I was told that hospitals have a financial incentive to identify deaths as from COVID. So hospitals record their deaths. They get paid on something called a DRG system. So depending on what your diagnosis is, they get a certain amount for that diagnosis. So a pneumonia is one thing, COVID's one thing, normal childbirth is one thing, and they get paid an amount based upon what the diagnosis is. The DRG, which is the amount you can pay for COVID, is high because many of the people with COVID have a lot of disease, right? They're in ventilators, ECMO, they're on all kinds of really complicated stuff. There is no perverse financial incentive for people to write things as COVID, and an incredible disincentive not to lie. I will tell you, hospitals get audited up the yin-yang. They look at all this stuff, and if a hospital will record a death as a COVID death and it wasn't, they risk getting so much fine and losing so much money from doing it wrong that the hospitals don't cheat on this. The hospitals do not, the reason hospitals are calling things COVID is because they have COVID. It's not a financial incentive. So the recall of the Moderna vaccine in Japan, this happened in Okinawa. And it's a concern. So in Okinawa, which is a little place south of Japan, southern islands of Japan. Actually, I lived in Okinawa for a while when I served with the United States Navy, taking care of the many Marines that are in Okinawa. If you ever have a chance to visit, it really is an amazing place. A tremendous amount of history and incredibly wonderful people. So Okinawa is there. So it was recalled in Okinawa because they found stuff in the vials. And so there was stuff in the vials that didn't look right. And this happens with many medications. So many medications are done somewhere in the bottling process different. The people who make the vaccine and bottle the vaccine in Japan are different from the US. There have been no reports of contamination in the vials here. But again, this is the kind of stuff that you look at to be sure that there's nothing in the vial. Now, in all the years, I don't think I've ever found anything in the vial, but others have, because you can imagine these are made on an assembly line, and there's a machine that goes wrong or whatever else, and there's something in the vials. We do not think it's anywhere in the US vials. And just like should happen, they see it, they recall it. So someone says, is the booster specifically created for the Delta strain? No. And I think that's why the CDC and the FDA are trying to call this a third dose. It is not specifically created for the Delta strain, and this is a problem. And the problem is there's so much of this virus circulating that it is mutating quickly enough that you're not going to be able to do it. Now, the flu vaccine does mutate, but typically it mutates slowly enough that you can find which vaccine is circulating in January and February in Australia, South Africa, and South America, which is 6 months ahead of us in the flu season. Say, this is likely the one that's going to spread in the US, and then you have between about February and September to produce this new vaccine. And so each year for the flu, it truly is a booster made for the virus that's going to be there that year. Now, sometimes it's a great match. Sometimes it's a different one than the one circulating there. And in those years, it's not a very good match. But again, making the flu vaccine is made mostly in eggs. And any of you who've raised chickens knows in March and April you get so many eggs. And it's raised in eggs starting in March and April, purified, and then made in September. So, and that's because the flu strain changes maybe once a year, but typically once every 2 or 3 years. So you have a chance to make that. The problem with Delta is it changes so fast that you'd never have, it'd be like whack-a-mole. So let's say that in February of this year, we looked for the virus that was circulating that we wanted to put in this year's booster. The Delta variant wasn't even known about then. So basically, if you looked in February, you'd have made it against the Alpha variant, which was the predominant strain in February. So you would have made this big thing for the Alpha strain. Turns out by September, when you'd get this ready, there's no more Alpha strain left. It's all the Delta and maybe the Lambda, maybe the C12. Let's say now you started to do a booster against Delta. There's no reason to think that by 6 months when you got this done, that we wouldn't be dealing with a new and different variant. And this is going to be one of the big issues. What we have to do as a world is to decrease the number of new variants that come out so that it slows down the development of new variants so that you can actually make the booster. But with the huge amounts of disease that we're seeing in the U.S. Southeast, with the huge amount of disease that we're seeing in Iran, with the large amount of disease that we're seeing in places in Africa, the worry is that it's going to spread a lot in one of these really populated cities, and now you'll have a new variant, and all the work that went into making one against Delta is going to be for naught because this new one is new. So this is the real worry, and this is the reason that we as a world have to decrease the profligate spread of this virus, because the spread of this virus is going to lead to variants that are even worse than Delta. And that's the worry. And when you look at these variants that spread, they did not spread because of the vaccine. They all spread before the vaccine, or the Delta spread after the vaccine, but in an area where there was no vaccine. So it's not like the Delta spurred on the development of the variants, or the vaccine spurred on the development of the variants. These variants came because there was a lot of spread, and that's why we really need to tamp down the spread of this so that we do not have some new and even worse variants coming. I think the areas that we worry about these new and worse variants are places where have not had a lot of vaccine, not had a lot of disease. They could have a lot of spread, and you could wind up with some really nasty variants. Because these new variants that could come out could be even more transmissible than COVID, than the COVID Delta. It's hard to believe, but it could be, or be more able to escape the vaccine. That would be a terrible thing, but could be one of those things that could occur. So there's one more question coming out here, and we'll take a look here. It's 7:04, so I'm getting buzzed here that I think it's come home for supper. All right. Yeah. So again, so what are my recommendations? My recommendations are stay healthy, still find some joy in your life, do some exercise, be with the ones you love, eat well, exercise. If you want to take supplements, that's great, and be safe. If you're going to go out, avoid crowded areas, especially crowded rooms where there may be other people who have COVID. If you are going to go in those places, please wear a mask. Masks are not perfect, but they work. And so while masks are not perfect, there's nothing that's perfect, but masks are one of the things that you can do. Get a vaccine. I mean, I think the data on vaccine is getting increasingly clear that the vaccines are safe and effective, and the risk of the side effects is far greater from the vaccine than the risks from not getting the vaccine and getting the disease are far higher than the risks of the vaccine itself. So please get that. And what we've asked from the beginning here is to be safe and to be kind. We've seen some really frayed nerves over this time, and I know people are nervous and worried watching our hospital being so full. The idea that we have to have a morgue truck to hold the extra bodies, this is really a troubling time. So what we're asking people is be safe and be kind, and we'll do this again next week. Thanks.